for eye care professionals, and it's the first of a series of videos that we will provide some practical tips for the everyday clinic. A common complaint that I may see in my clinic is the red eye. So the red eye implies inflammation, and it's caused by either an allergy or an infection or an autoimmune process. And the main differentiation that I see in my everyday practice is whether I treat it with some anti-infective, which is most commonly antibiotic, or some anti-inflammatory, which is most commonly a steroid drop. So the way I differentiate is whether there is corneal involvement. If there is corneal involvement, then I have to treat with some kind of anti-infective. And most commonly that's an antibiotic. If there is no corneal involvement, then we can treat with some anti-inflammatory, and that's most commonly is a steroid drop. For the cornea, when it's involved, we're looking to see whether it's a bacterial ulcer or herpes simplex keratitis. And these usually come with pain and photophobia. And a differentiating diagnosis where that comes with also pain and photophobia without corneal involvement is the acute anterior uveitis. When the cornea is not involved, then most commonly is a conjunctivitis, and also we can rule out the episcleritis. And this is treated most commonly with anti-inflammatory drops. So any type of conjunctivitis will improve with anti-inflammatory drops, including allergic reaction, bacterial or viral conjunctivitis. Even in bacterial conjunctivitis, where we get extreme discharge and also it's extremely contagious, anti-inflammatory will make it better. It's better if we combine it with antibiotic as well, but even anti-inflammatory will improve the inflammation that is on the surface of the eye. Of course, it's better if we can differentiate between allergic and viral conjunctivitis. Even though the treatment is the same, it's still embarrassing when the mom comes back and tells you that her child that you've diagnosed with allergic conjunctivitis gave that red eye to the rest of the family, or her child that you've diagnosed with viral conjunctivitis was treated and got better and then it recurred and then recurred again. So it's most likely an allergic condition. Timing can be helpful because in different seasons we tend to get different types of conjunctivitis, but there are always exceptions. So in the spring and summer we expect to have more allergic conditions, and in the winter we expect to have more viruses. Of course, you can also get the bacterial conjunctivitis, which is less common. And even in the bacterial conjunctivitis, you can combine the antibiotic with the anti-inflammatory, and this will still be helpful because you calm down the inflammation on the conjunctiva at the same time. With all this we talked about, there is also some exceptions, which we'll talk about later on. Bacterial conjunctivitis is much more rare, and it comes with a lot of discharge, and it's much easier to be transmitted to the other eye and to other people. And it is treated with antibiotic drops, but you can also combine it with anti-inflammatory, as it's going to help with the inflammation that is happening on the conjunctiva at the same time.